Abortion is a safe and legal medical procedure that ends a pregnancy. Millions of women around the world have abortions each year. There are two main types of abortion: medical abortion and surgical abortion. Both types are very safe when performed by trained medical professionals. Medical abortion is a safe and effective way to end a pregnancy in the first trimester. It is a non-invasive method that can be done early in the pregnancy, providing a private and controlled option for those who choose it. It involves taking two medications, imifepristone and misoprostol. These medications are prescribed by a healthcare provider and are taken in a specific sequence to ensure effectiveness. These medications work together to stop the pregnancy from growing and to cause the uterus to empty. This process mimics a natural miscarriage, making it a familiar experience for the body.
The first medication, mifepristone, blocks the hormone progesterone, which is needed for a pregnancy to continue. Without progesterone, the lining of the uterus breaks down and the pregnancy cannot continue. This is typically taken at the clinic under the supervision of a healthcare professional to ensure that the process begins correctly and safely. The second medication, misoprostol, is taken 24 to 48 hours later, usually at home. This allows for privacy and comfort during the process. Misoprostol causes cramping and bleeding, which expels the pregnancy tissue. These symptoms are a sign that the medication is working, and the process is nearing completion. It is important to follow up with a healthcare provider to ensure that the abortion is complete and to address any concerns.
Surgical abortion is another safe and effective way to end a pregnancy. It is a medical procedure performed by healthcare professionals in a controlled environment, ensuring the safety and well-being of the patient. There are two main types of surgical abortion: vacuum aspiration and dilation and evacuation, also known as D and E. Each method is chosen based on the stage of pregnancy and the specific needs of the patient. The type of surgical abortion recommended will depend on how far along the pregnancy is. Early-stage pregnancies may require different techniques compared to those that are further along.
Vacuum aspiration, also known as suction aspiration, is typically used in the first trimester. This method is less invasive and can be completed relatively quickly, often within minutes. It involves using gentle suction to remove the pregnancy tissue from the uterus. The procedure is performed under local anesthesia, ensuring minimal discomfort for the patient. Dilation and evacuation, or D&E, is typically used in the second trimester. This method is more complex and may take longer to perform, but it is equally safe and effective. It involves using a combination of instruments and suction to remove the pregnancy tissue. The procedure is carried out by skilled medical professionals who ensure that the process is as smooth and safe as possible for the patient.
Both medical and surgical abortion are very safe when performed by trained medical professionals. Like all medical procedures, there are some potential risks and side effects. With medical abortion, these can include bleeding, cramping, nausea, and diarrhea. With surgical abortion, risks can include bleeding, infection, and damage to the cervix or uterus. However, serious complications from either type of abortion are rare.
Having an abortion does not affect your ability to get pregnant in the future. If you are not ready to have children now, there are many safe and effective methods of birth control available. It's important to talk to your healthcare provider about which method is right for you. They can help you choose a method that fits your lifestyle and your reproductive health goals.
Making decisions about your reproductive health can be complex and emotionally challenging. It's a journey that requires careful thought and consideration. If you are considering abortion, it is important to talk to a healthcare provider you trust. They can offer a safe space for you to express your concerns and ask questions. They can provide you with accurate information about your options, including medical and surgical procedures, and help you make the best decision for your individual circumstances. Understanding the risks and benefits of each option is crucial. Remember, you are not alone. Many people have faced similar decisions and have found the support they needed. There are many resources available to support you, including your healthcare provider, family and friends, and abortion support organizations. These resources can offer emotional support, practical advice, and even financial assistance if needed. Don't hesitate to reach out and seek the help you deserve.